Welcome to Nurse Ed Academy by Dr. Ju Utterwet. Today, we'll be discussing one of the most essential skills in nursing, handover. A handover is the process of transferring essential patient information between healthcare providers. Structured clinical handover has been shown to reduce communication errors within and between health service organizations and to improve patient safety and care, because critical information is more likely to be accurately transferred and acted on. When to implement a clinical handover. 1. There is a change in clinician, for example, shift change. 2. A patient is transferred to another health service organization, for example, from hospital to an aged care home, another hospital, community nursing, or palliative care service. 3. A patient is moved within an organization, for example, to the general ward after surgery. 4. A patient's care is discussed during multidisciplinary team rounds. 5. A patient is transferred for a test or appointment. 6. A patient is discharged. A structured clinical handover approach enhances clarity and efficiency. Several frameworks exist, with ISBAR and ISABAR being the most widely used. ISBAR framework. I. Identification. Introduce yourself, your role, and the patient, name, age, bed number, diagnosis. S. Situation. Briefly describe the patient's current condition or reason for hospitalization. B. Background. Provide relevant medical history, past treatments, and recent interventions. R. Assessment. Summarize vital signs, pain levels, clinical concerns, or any ongoing issues. R. Recommendation. Outline necessary actions, e.g., monitoring, medication adjustments, further assessment. ISABAR framework. The ISABAR method follows the same structure as ISBAR, with an additional step. O. Observations. Include the most recent vital signs for a more detailed clinical picture. Example. Good morning, I'm Nurse Alex. I'm handing over Mr. Smith, a 68-year-old post-op patient who had an appendectomy yesterday. He has no known allergies. His vitals are stable, he reports mild pain managed with paracetamol, and there are no signs of infection. We need to monitor his fluid intake and encourage mobilization today. Types of nursing handover. Different clinical settings require different handover styles. Bedside handover. Conducted at the patient's bedside with their involvement. Ensures transparency and patient engagement. Verbal handover. A spoken report between nurses, e.g., shift changes, team updates. Written handover. A documented summary in patient records or digital systems. Electronic handover. Using digital tools for real-time updates and structured data. Best practices for an effective handover. Use a structured format. Be clear and concise, avoid irrelevant details. Highlight critical changes in patient condition. Engage the patient when possible for bedside handover. Ensure privacy and confidentiality. Confirm understanding, ask and answer questions. Common mistakes to avoid. Rushing through the handover. Providing unstructured or unclear information. Ignoring patient concerns or recent updates. Not allowing the receiving nurse to ask questions. Effective handover is critical for ensuring patient safety, continuity of care, and clear communication among healthcare professionals. Want to learn more nursing skills? Subscribe to Nurse Ed Academy for more educational nursing videos.